From Japan's nationwide flu emergency to a shocking new link between long COVID and heart rhythm disorders, and a terrifying HIV outbreak in the Pacific, this week's global health headlines are a wake-up call. Let's dive into what's happening and why it matters. Japan is on high alert. The government has officially declared an influenza epidemic as hospitals overflow and schools, colleges, and markets shut down nationwide. Over 4,000 flu patients were reported in just 1 week, a nearly 1,000 case jump from the week before. Doctors warn that if the trend continues, Japan could face its worst flu season in over a decade. On COVID front, the internet lit up again with claims that COVID vaccines cause cancer. But here's the truth, most missed, as per study conducted by South Korean researchers, proves a causal link between COVID-19 vaccines and an increased risk of up to 6 types of cancer have gone viral in recent days. These claims caused a wave of misinformation, with prominent figures and platforms using their professional titles to lend credibility to them. In fact, the Daily Mail just corrected its story that wrongly said Korean scientists had proof vaccines raise cancer risk. In fact, in reality, those same researchers said the opposite. They found no causal link. Promoters of this misinformation were omitting a key phrase from the excerpts they cited: epidemiological association without causal relationship, meaning their data simply showed an association, not evidence of danger. And here's the kicker. So far, there's no credible proof anywhere that COVID-19 vaccines cause cancer. Even global medical and scientific authorities have unequivocally affirmed the safety of the vaccines and have denied any link to cancer. Experts from BMJ, Global Vaccine Data Network, GVDN, and National Cancer Institute in the United States confirmed that there is no evidence that COVID-19 vaccines cause cancer or led to its recurrence or progression. In fact, decades of research and multiple large studies say otherwise. Misinformation spreads faster than science, but facts still matter. Now, a new study from Sweden's Karolinska Institutet has revealed a disturbing connection between long COVID and a rare heart rhythm disorder called POTS, short for postural orthostatic tachycardia syndrome. It causes the heart to race abnormally fast, even when simply standing up. The study found 1 in 3 severe long COVID patients may have this condition, most of them previously healthy middle-aged women. Symptoms like dizziness, fatigue, and brain fog may not just be COVID after effects. They could be signs of a serious undiagnosed heart issue. Before COVID-19 infection, 10% and 31% of the patients with POTS reported reduced and high physical activity levels, respectively. But after COVID-19 infection, 68% of patients reported reduced physical activity levels, and only 1% maintained a high physical activity level. Over 63% of all patients with post-COVID-19 POTS reported a high symptom burden. Doctors are now urging anyone with rapid heartbeats post-COVID to get checked. In Fiji, a horrifying trend called Bluetoothing is driving an explosive HIV outbreak. Here's how it works. Drug users inject meth, draw some blood, and pass it on to others, using the same syringe over and over. What started as a way to save money has now turned deadly. HIV cases have jumped from 500 to nearly 5,900 in just a decade, and officials warn that 3,000 new infections could emerge by next year. Health experts call it a national emergency and a potential threat far beyond Fiji's borders. Now, do you know 99% of heart attacks linked to 4 risk factors? A new study of 9 million adults across South Korea and the US found that 99% of all heart attacks, strokes, and heart failures are tied to just 4 factors: high blood pressure, high cholesterol, high blood sugar, and smoking. Even among women under 60, 95% of cases were linked to these causes. The study was published in the Journal of the American College of Cardiology. Doctors say this is the loudest warning yet. If you want to avoid a cardiac event, control these 4 numbers now. From pandemics to preventable heart disease, the message this week is clear. Health crises don't wait, and neither should we. What do you think about these latest updates? Let us know in the comments below. Don't forget to like and subscribe so you don't miss next week's update. Stay safe and see you then.